This is providing mouth care with people that have with teeth. I'm sorry. So what I would do first is I would enter the room, I would knock, I would ask the patient if they need help with mouth care. I would say, I'm Connor, the CNA. I'm here. How are you doing, mister? And whoever it was to verify the patient. Then I would, once they identified that they needed help with the skill, then I would go and I would tell the resident that I would be washing my hands, gathering the supplies, and closing the curtain. First thing I would do is I would gather all my supplies, which would be a towel, a basin, a toothbrush, a cup with water, and toothpaste, of course, and a barrier to go over the table that I would be putting all the stuff on. Then I would also grab a set of gloves. Then I would close the curtain. I would put the towel on the resident, and then I would then put my gloves on. I would take the toothbrush out of the wrapper. I would dip it into the water to make sure it was wet. I would then get the toothpaste, put it on the toothbrush, and I would ask the resident to open their mouth, and then I would start brushing their teeth. And then I would brush their tongue as well. And then after they were done, I would take the toothbrush and I would set it down in the basin. I would not set it in the basin. I would set it on the barrier. Then I would offer them a rinse with a basin around their mouth. And once they once they rinsed, I would ask them if they would like to rinse again. If they say no, I wouldn't, but they said yes, and I would. Then after they were done, I would I wouldn't be done with the skill, but I would be done with brushing their teeth. I would then throw away my dirty trash, which would be, I would dump the cup into the basin. I would then take the cup, the wrapper, and the toothbrush, and I would throw that away. I would then take the basin to the sink. I would dump out the basin in the sink. I would wash the basin under the water. I would hold the basin with a paper towel. I would wipe the basin with different paper towels on the inside and the outside. I would then take the basin and I would put the toothpaste in the basin and put it back in storage where I got it from. Then I would take the towel and put it in dirty laundry. I would then take the barrier off the table and throw that in the dirty trash. After I was done with that, I would ask the resident if they needed help with anything, and then I would tell them that their call light was right there. And I forgot to mention something earlier, which was when I was first helping the resident, I would help them up in bed to a nice position where they were around 90 degrees. But pretty much for that, I'm done with the skill.